For those undergoing IVF, there are two primary options for embryo transfer: fresh embryo transfer and frozen embryo transfer, or FET. While both methods have their advantages, frozen embryo transfers are increasingly becoming the preferred option for many fertility specialists due to the evidence suggesting that they lead to better pregnancy outcomes. But how do frozen embryo transfers compare to fresh transfers when it comes to pregnancy complications? Fresh versus frozen embryo transfers. In fresh embryo transfers, the embryo is placed into the uterus right after it has been fertilized and cultured for a few days in a lab. On the other hand, in frozen embryo transfers, the embryo is first frozen and then thawed at a later date for implantation into the uterus. Over recent years, FET has become more common due to its potential benefits, including a higher chance of pregnancy. But the question remains, does FET result in fewer or more pregnancy-related complications? Complication rates, frozen versus fresh embryo transfers. A comprehensive review of over 30 high-quality studies compared pregnancy complications between fresh and frozen embryo transfers. Researchers focused on singleton pregnancies to exclude the confounding factor of multiple births and analyze the risks of various pregnancy-related complications. Preeclampsia and high blood pressure. Preeclampsia, or high blood pressure during pregnancy, can be a serious complication, leading to preterm delivery and, in rare cases, stillbirth or maternal death. Fresh embryo transfers show a lower incidence of high blood pressure complications compared to frozen embryo transfers. Research suggests that FET increases the risk by 1.4-fold, with occurrences rising from 7 to 10% in fresh transfers to 10 to 14% in frozen transfers. Gestational diabetes occurs when a mother's blood sugar levels rise to an unhealthy level during pregnancy. The research found that the risk of gestational diabetes is similar for both fresh and frozen transfers. There is no significant difference in the likelihood of developing this condition between the two methods. Postpartum hemorrhage is excessive bleeding following delivery, often more common in cesarean sections. This condition affects about 4% of pregnancies and was found to be slightly more common in frozen embryo transfers, occurring in about 5% of cases. Placenta previa occurs when the placenta covers part or all of the cervix, causing complications such as bleeding during pregnancy and preventing vaginal delivery. Interestingly, placenta previa is 60% less common after frozen embryo transfers compared to fresh transfers, which is a significant reduction in risk. Placental abruption, a serious condition where the placenta separates from the uterus before birth, can cause severe bleeding and, in some cases, lead to stillbirth. This complication is also 60% less likely to occur with frozen embryo transfers than with fresh transfers. Premature delivery, defined as birth before the 37th week of pregnancy, is a critical concern because it increases the risk of medical complications for the baby. FET was found to reduce the risk of premature delivery by 7% compared to fresh embryo transfers. Additionally, the risk of very premature births before the 28th week is 20% lower in frozen transfers, significantly improving the chances of a healthier delivery. Perinatal mortality refers to the death of the fetus after 28 weeks of pregnancy or within the first 7 days after birth. In the United States, this is a rare occurrence, affecting about 5 in 1,000 deliveries. However, studies show that frozen embryo transfers reduce the rate of perinatal mortality by about 12% compared to fresh transfers, providing a safer option for the baby. Frozen embryo transfers offer several advantages over fresh embryo transfers in terms of pregnancy complications. While FETs increase the risk of pregnancy-related high blood pressure, also known as preeclampsia, and postpartum hemorrhage, they also significantly reduce the risk of placental complications, premature delivery, and perinatal mortality. For intended parents considering IVF, FET may offer a safer route to a successful pregnancy and healthier outcomes for both mother and baby. At Surrogacy 4, all We are committed to guiding you through every step of the fertility process, whether you are exploring IVF embryo transfers or gestational surrogacy. Our experienced team of fertility specialists and counselors can help you determine the best approach for your unique situation to ensure a successful and healthy pregnancy. For more information or to schedule a consultation, contact us at 212-661-7673 or email us at info@surrogacy4all.com. Visit www.surrogacy4all.com to learn more about our services and how we can assist you in achieving your dream of parenthood. Let us help you take the next step toward building your family today.